Hello, hello, and welcome back to another episode of the Holistic Wellness Podcast and YouTube channel with Dr. Judy. I'm your host, Dr. Judy. I am an internal medicine physician, holistic wellness expert, and I promote and share the message of P3, plants, prayer, and peace, helping people to become whole in mind, body, and spirit. And today I have a very special guest to share with you her knowledge and experience on the topic of sleep. This is so important. So our guest today, hello, is Dr. Valerie Cacho. She is a integrative sleep medicine physician, women's sleep expert, and she is a guide and a resource for helping women in midlife to get better sleep. She has a practice where she sees patients. She also has a YouTube channel and a membership, and she is the owner of Sleephoria. We'll have all the links to her business, her YouTube channel, and her membership in the links below. But thank you so much, Dr. Cacho, and welcome to the channel.
My pleasure. Thank you so much, Dr. Judy, for having me here.
Awesome. We met on Instagram, like I meet most people, and then found out that we had a lot in common, and we chatted. And then I was like, okay, I have to have you on my YouTube and podcast. Now, sleep. So for those of you that have been following me for a while, you know I'm a lifestyle medicine physician, and one of the pillars of lifestyle medicine is sleep. Now, I have been talking exclusively about one pillar, food and nutrition, whole food, plant-based nutrition. But I've broadened it now, and I touch on all of the pillars on lifestyle medicine, and I also touch on spirituality and the mind, mental health and mindset. So today we're going to talk about sleep, which is one of the pillars of lifestyle medicine. And so this episode will be educating you about sleep and also empowering you, for those of you that are struggling with sleep, for ways that you can get better sleep. So let's get into it. How important is sleep in overall health? I know that we sometimes in our society, it feels like we minimize sleep. So is sleep important? And if so, how important is sleep?
Oh, Dr. Judy, great question. And most definitely, I like to say sleep makes everything better. If you go from head to toe, right, it makes your brain health better, your cognitive function, your frontal lobe works better, your memory works better, you can make better decisions, your emotions are better, it's better for your heart health, you have less risks for things like high blood pressure, irregular heartbeat, heart failure, if you are getting an adequate amount of sleep and also treating any underlying sleep condition, even your metabolic health, your hormones work a lot better. Not sleeping well is actually very inflammatory, and you can have issues with insulin resistance and, having a hard time losing weight, even down to your immune system. So, yes, sleep is so important, and it really goes in line with the mind, body, and spirit. And if you're not sleeping well, it's hard to eat, the healthy foods that you want to eat, because your body tends to crave some of these sort of simple carbohydrates, sort of the fast foods, the processed foods. And I love how you are in the framework of lifestyle medicine. And since I'm super biased because I'm a sleep doctor, I say if you're not getting adequate sleep, it's really hard to maintain your spiritual health. It's really hard to move your body. You're going to be prone to wanting to, intake more toxins and the habits that aren't good for you, just because you're so drained all the time. So learning about the pillar of sleep and using that to help improve other aspects of your life is so key.
Oh, that is so good. You totally gave a head to toe explanation of how sleep affects every organ system and every part of our life. So how many hours should we be getting? How many hours of sleep each night?
Great question. So CDC actually does data on this, and you can look on their website and look at, depending on what state you live in, how much sleep people are getting. Ideally, it should be at least 7 for adults. And there's a lot of information out there that women need less sleep or get less sleep or need more sleep than men, which is totally false. I saw one post recently, and it was like, women need more sleep because we use our brains more. And I was like, there's no literature to support that. There was a study that I reviewed in Canada. It looked at over 4.4 million people in over 30 countries. And so they looked at 14 different health outcomes, things that I just talked about: high blood pressure, stroke, cancer risk, metabolism. Getting closer to 7 was ideal. So, there's a U-shaped curve somewhere between 7 to 8, 7 to 9. Find out how much sleep you need to feel good. If you have a really busy life, if you are taking care of elderly parents or young kids and you aren't able to get at least 7, try to get at least 6. Less than 6, we definitely see way more negative health outcomes. So shoot for 7, but give yourself some grace if you are getting less than 7, because there's different seasons in your life. And maybe right now you're in a season where you're not able to get 7, and that's okay. Things can certainly shift and change.
Okay, so 7 to 8 hours. And is there an ideal time that we should try to get in bed before a certain hour?
That's a really good question. And so we have built within us, right, this God-given clock, their circadian rhythm. And so it's one of those things that I encourage everybody to look to figure out when you feel sleepy. Because sometimes we get into this pattern where I have to get up at 6 o'clock to start my day, and that means I need to be in bed by 9 or 10. However, if you're not sleepy at 9 or 10 and you're truly a night owl and you don't fall asleep until midnight or later, then sometimes there's this little unrest and you're maybe asking your doctor for some medications, or you're trying to really reaching to figure out, why you're not sleepy. Then you're getting upset and you can actually develop insomnia from this. And so there's a great questionnaire called the morningness eveningness questionnaire. And it helps sort of, if you're not too sure when your true bedtime is it can help guide you towards that. But sort of like, mealtime, right? Do you eat just when the clock says 12:30 and you have your lunch break, or do you eat when you're hungry? Do you drink water when you're thirsty? So sleep when you're tired. And if it comes at an inopportune time, maybe you truly are a night owl and your true bedtime is like 3 o'clock and that just doesn't work with your schedule because, you have to be at work at a certain time. Well, there's ways that you can shift your clock back.
Okay, that's very helpful. That's different than what I had thought. For some reason, I thought it was like, I feel like I've read somewhere that that it's like you should be in bed before 10 o'clock or something like that. But I like how you're saying, listen to your body and know when you're feeling tired.
Exactly. I mean, that's for probably the majority of the population, about 80%. There's a whole condition that I'm referring to as being a night owl. It's called delayed sleep phase syndrome. And that's somewhere between 15 to 20% of the population. Yeah, and that's something that I actually see very commonly. And I think some of the literature that goes about, sleeping before midnight, sleeping before 11, sleeping before 10 has to do with some of our hormone release, like growth hormone. It starts to get released throughout the night. And they say, before 11 p.m., it's probably more helpful. I don't think we have like super strict cutoff times for that. I think, it's really important to listen to your natural body. When you're hungry, you eat. When you're tired, you sleep. When you're thirsty, you drink. And you can shift your life around that if possible. And we can talk about strategies for doing so a little bit later. But if you want to sleep earlier and you can't, then, sort of taking a look at the habits that you have in and around your bedtime and even throughout the day, because those can set you up to making sure that you're going to bed when you want to and your sleep is restful and peaceful.
Oh, I love that. I found that as I've aged past 35 plus, 40 plus, I get tired earlier, like around 9, 10 o'clock. If I stay up to 11, I'm like exhausted.
Yeah, and that's okay. And sometimes your clock can shift depending on underlying health conditions, depending on your level of activity, depending on your level of stress, and even exposure to sunlight. Yeah.
Okay, that makes sense. So what are some signs that someone may be dealing with sleep deprivation? Because I feel like there are people that are dealing with a lot of conditions, but sleep deprivation is probably one of them, but they're not aware of it. Maybe they don't know. And it's probably manifesting as something else, like hunger, for example, problems with appetite.
Yes,
Stress. Are there
such a
any
good
signs?
question. For sure. I would
Take your time.
I'm like, let's unpack this. All right. So talking to your audience, right, of professional women. And I think it's so difficult because a lot of us are exhausted. A lot of us are tired. And when we talk to our friends about it, they're in a similar boat. But just because we all sort of feel maybe a little bit tired, drained, it doesn't mean that there's nothing that you can do about it. So number one, I would say prioritize sleep. Try to get at least 7, as close to 7 as much as possible. If you are getting 7 and you're waking up unrefreshed, if you feel like you have to grab an extra cup of coffee or tea, if you're wanting to nap, if you're having problems with your memory, focus, and attention, those are definitely some signs that you should talk to a healthcare professional about, your level of exhaustion. Sleep, again, in sleep doctor, I'm really biased. I'm always going to want to rule out obstructive sleep apnea, but there's sometimes vitamin deficiencies, we can have heavy periods still depending on what time we are. Iron deficiency can play a role, thyroid issues. I always like to have a similar framework, mind, body, and soul, mind, body, and spirit. Where is the disruption between that? Because there's emotional exhaustion, right? There's physical exhaustion, and then there's even soul or spiritual exhaustion. Your relationships, are you living in alignment with your values? Is your day to day, making you feel alive and you're thriving and you have like this really purposeful mission that you're accomplishing? Or are you just sort of like stuck and I'm just like waiting for retirement and then I get to do all the fun things that I wanted to do? So just thinking of it in terms of that sort of framework and sort of really expanding beyond sleep deprivation. But sleep deprivation is just, you're really tired and you're fatigued and you're having a hard time making through the day.
I love that. Bringing into your purpose and being in alignment. Yeah, modern life can be exhausting. The jobs, then you've got the family, and then if you're in midlife, you have your parents that are aging, so you're responsible for many different things. And sometimes your own health and your own sleep can take a back burner, right? Because like the kids are going to sleep, so then that's your only time to work on your side business or the only time for you and your spouse to talk and to chat. So what are some strategies that busy women can use to make their sleep a priority or to get better sleep?
Oh, 100%. And I would say it goes back to values, right? Talking more about that mission, that purpose, that vision you have for your life. Making sure it's your own, right? It's your calling. I think living within that calling is so key. Because oftentimes what I find is that, we have our full-time jobs. We want to help our family. And then we have our side hustles and our side careers, really our passion projects. And honestly, ladies, it's okay to say no. It's okay to stop doing things. Just sort of the way I was raised and the women around me, we were really supportive of our family. It was almost like, family first and then work. And then let's see whatever's with left over. Let me take care of myself. But right, I think that's so backwards. And I think that we've sacrificed so much for so long. And if I think you don't realize how, if you're whole, right? If your needs are taken care of, you can do more so and even more for your family, more for your purpose, more for your mission, more for those around you and your community. And I think it's just having that shift in mindset that's so important. And then looking at our list of things to do, is it something that we really need to do ourselves? I like to think of the framework. It's like do, delete, or delegate. Does this really need to be done right now? Okay, then let me do it. If not, let me have someone else do it. And, is this really in alignment with my values? If not, let's just delete it. Because I think we are sort of sold on that, we're super women. We can do anything we want. And I definitely believe that. But I think it's timing, right? We all have 24 hours in the day. And again, if we're not sleeping well, it takes longer to create that PowerPoint, right? To create those Canvas slides. It takes longer to respond to those emails because our brain just isn't working well. And I'm quite guilty of it. I've been staying up late, just, finishing some of the work that I need to do for my clinic. And then I got sick. And then I'm out for 3-4 days. And I'm like, well, what am I doing really? Versus if I just got maybe like another hour of sleep, probably that would have been better for my immune system. So I think that's just so key. It's just, what are your values? Are you living within your values? And then with the reality of the situation. And again, seasons change. And maybe when your kids are older or maybe they're in college, then you'll have more time to focus on that. But value-based living, I think, is just so key in terms of being able to call it quits. And then really having those healthy boundaries. Okay, maybe I'm a person that needs 8 hours of sleep to really feel good. What can I remove? And I read this thing actually it was a post on Instagram, and it was like, you don't lack time, you lack focus. And I thought that it was so key because I think for me, I'm always like, there's not enough time. I need to do this, this, and that. I need to read this book. I need to follow this person and, send these emails out. And then, I just, wanted to get into reading more novels. And I read this novel and I read the whole thing in one day and it was like 6 hours. And I was like, wait, where did that 6 hours come from? And if it's something that I really want to do, I will get it done. So I don't think it's really a matter of time. It's just like, where are my priorities and how can I stay focused on what I need to do? And then undertone to that is, making sure I get enough sleep to support, when I'm more rested, I have more focus, I have more clarity. and
That
things
is
just
so
will come
good.
together. Yeah.
Now you said was it do, delete, and delegate?
Yeah.
What was the first
Delegate, do,
D?
or do. Just do
Oh,
it.
do? Okay,
Do,
do,
delete, or
delete, and
delegate.
delegate. I like that. And you touched
Yeah.
on saying no, not feeling like we have to take on the burdens for everything. And I think that's so
Yeah.
important because when I see women, I see women thinking that they have to do everything, right? Like
Yeah.
they hesitate to outsource tasks,
Yeah.
right? Like even let's say, like I'm not a mom, but if I was a mom, I would outsource every single task in the household that I did not want to do that did not bring me joy. That includes laundry, house
Yep.
cleaning, even
Yep.
cooking. If I could find someone that could cook healthy vegan food, I would hire
Yep.
them.
Yep.
But there's this thing where we feel like I'm less of a woman if I pay someone to do my laundry. Like I'm less of a woman if I pay someone to cook for my family. Like, no, you're not.
No, you're not. And I think it's just, you're operating within, they say your zone of genius or like your
Mm-hmm.
true calling, right? If you're called to serve and called to help other people, it's okay to ask for help. We are very social creatures, right? There are people who love to do laundry, who love to clean, who love to cook. And maybe that's their mission and that's their calling.
Mm-hmm.
And what not better to, use the resources you have to help them help you so you can continue on your journey.
Yeah, and I love how you said that we're better able to help others when our own cup is full. So that
Definitely.
includes sleep, but then also eating healthy, getting enough exercise, managing stress. Like you are better able to fill other people's cup when your cup is whole and full.
Yes, exactly. Amen. Easier said than done, as I
I
say
know.
that, thinking about my own life. But, this is why I'm here. So, as I speak, it's
Yeah.
also reminders to myself. And, even I'm a sleep doctor, my sleep isn't perfect 100% of the time. You just do the best you can with what you've got and give yourself so much grace.
Yeah.
Yeah.
Yeah, you mentioned recently working late. I did that a couple weeks ago when I was launching. I was launching
Mm.
a digital course because I do programs and courses. And I was so excited and so into it. I was staying up until 2 a.m., like several nights in a row. And I knew that I needed to get to sleep, but I was so excited, so wired. I wasn't even tired. But then once the program ended, I felt exhausted. I started to feel
Yeah.
sick, like a little bit of a viral upper respiratory
Mm-hmm.
kind of thing, like congestion and tiredness. And then I needed like a week or two to recover. So it's a continued reminder
Yeah.
to get adequate sleep. But yeah, sometimes it's hard.
Most definitely. Yeah. Different seasons. And it's your body will remind yourself, wait, okay, you did all that work. Now let's just take a
Hmm.
break and let's sit back and sort of, give ourselves
Yeah.
give ourselves some
And when
quiet
you're
time.
around midlife too, sometimes I find it takes longer to recover from sleepless nights. Like an undergrad, you can probably stay up all night and study. I'm sure many of people did the all night studying situation, take the
Oh
exam,
yeah.
feel fine. No? Like I don't know how I would do in medical school now. Like like today's
I say the
Q4,
same thing.
36
30-hour
hour
shifts. Oh,
shifts.
36. I think mine were 30. Yeah. It's good that it's prior choice now. I think there's been a little bit of a
Yeah.
shift depending on what specialty you are. But yeah, we're getting
Hmm.
there. It's just
Yeah.
great to have platforms like this where we talk about it. Yeah, talk
Yeah,
about our
they're getting there.
experience.
Oh, so I wanted to ask you, so we talked about busy women, professionals, tips for sleep. We talked about benefits of sleep. What about napping? Is taking a nap during the day harmful or can that be helpful?
Great question, Dr. Judy. And so I think it's take a step back and then ask, right? In medicine, it's, depends on the person. So if you're someone who's coming to see me for insomnia and maybe you have issues with sleep hygiene and, you're not too sure about your circadian rhythm, I would say for those folks, probably not a great idea to nap because we're trying to establish a baseline pattern and we're trying to establish a routine that can help support your sleep. I would say if you're, a woman who is working full time taking care of kids and then your elderly parents and you have the opportunity to take a 20, 30-minute nap, it's probably okay. So if there is a rule of thumb, right, if you don't have insomnia and you're more of like the worried well or trying to optimize half an hour, before 3 p.m. is sort of okay. The problem is if you take a nap too late, which oftentimes, we take a nap because we're sleep deprived, or maybe we have an underlying sleep condition and it's after work, and maybe that nap is, an hour or two. And then 10 o'clock rolls around and we know we should be in bed, but then we're not sleepy until after midnight. Yeah, so that's something to really be cautioned out. I can personally say I love naps. If you have the opportunity to nap, you made a lot of right choices in your life. If you can take a good 15, 20 minute, 30-minute nap. So definitely doctor approved, but it really just depends on, I think, what underlying condition you have. And if you have insomnia, maybe not best to nap until we get you more onto a set routine.
Okay, that's good. Thank you for sharing that. So now I want to switch to natural remedies, because during the pandemic, there was a lot of talk about melatonin and how taking that can optimize your immune system. I know several, like I was seeing a naturopathic doctor, and some of them recommended like 10 milligrams of melatonin a night, I think, or something like that. So I've been taking it, but I don't know if it makes a difference or not. But can you share with us if taking melatonin is good, and what natural sleep aids, natural supplements do you recommend?
All right, Dr. Judy. So melatonin, this is such a heated topic. So I'll start with what melatonin is and what it does for our body, and then shift into things that melatonin can support even beyond the sleep system, because that's something to learn about and we don't always know. So melatonin is a natural hormone that's released in the pineal gland, which is deep in the hypothalamus, in response to darkness, right? So it works on your circadian rhythm, which is your internal clock. Your internal clock is your circadian rhythm. It's based on light, darkness, and melatonin. And really what melatonin does, it helps support those sleep stages. And so we have 4 stages of sleep. There's 1 and 2, which are considered light sleep. There's stage 3, which is deep sleep. And then there's REM sleep. And we cycle through these 4 stages about every 90 minutes, maybe a little bit later, 4 to 6 times a night, depending on how long we sleep. There's a nice graph that I show my patients. And really what happens is, as you go to sleep, you're less tired as when you went to sleep. So the longer you're awake, the sleepier you get. And when you're sleeping, you relieve that pressure to go to sleep. That's your homeostatic regulation of sleep. On the opposite side of this graph is something called the circadian rhythm that we just talked about. And we start to see melatonin levels really peak as our pressure to stay asleep has gone down. So it can help keep us asleep. It's also really good for things like shift work or jet lag, right? When we're trying to move our clock, our bedtime. But really what's better is exposing ourselves to light or avoiding light at a certain time. So melatonin and light are called Zeitgebers, which is a German word for environmental cues that can affect your internal clock. Now, the problem with melatonin is that in the US, as opposed to some other countries, it's not regulated by the FDA. It's not a medication. So it's regulated like a supplement, like a food. With that said, there have been pretty big studies where they took over 30 different brands of melatonin. Some did not have any melatonin in it. Some had more than 300 or 400%. Some were mixed with serotonin, and some even had cannabis in it. And I think the pediatric study more recently. And so the brand that you get for melatonin is really problematic. For the most part, I would say people that I see who use it in my clinical practice use it for insomnia, meaning having a hard time falling asleep or staying asleep. And so it doesn't necessarily do that because it's not a hypnotic agent. We can talk about other herbs that can support that. Sometimes it's mixed with things like passion flower, chamomile, magnesium, which are a little bit more anxiolytic and help relax our brain. And beyond the sleep system, though, melatonin has been shown to be anti-inflammatory. So a study done in women who had breast cancer, if they took melatonin, they had a decreased risk as opposed to those who didn't for a secondary breast cancer event, which is really phenomenal. Yeah. So that's something to consider. We have a lot of melatonin in our gut. So bringing in the plant part, you can get melatonin from foods. Tart cherry juice is one of them. I know a lot of athletes use it for their muscle aches and pains. It can also support the sleep. I was giving a webinar yesterday and just talking to a lady about tart cherry juice. So we pulled up a study, really small study, 7 adults, but increased their sleep time from drinking tart cherry juice for 84 minutes, which was really phenomenal. So, it can be helpful, but I think it's probably overused. In the US, it's sort of sold like candy. It's just everywhere. For medical sleep, we use it for shift work, jet lag, and then another condition called REM behavior disorder, where people act out their dreams. That's associated with Parkinson's. Yeah, so that's the spiel about melatonin. Side effects can include vivid dreams, feeling really sedated the next day. You can have a hangover type effect, just like you can with Benadryl. For some people, it can lower their blood pressure, GI upset, and even headache. Yeah. So there are certain side effects from it. If it works for you, good. If it doesn't, then, more is not necessary. And then talking about the older population. So if you're above 50, maybe above 65, some research does suggest there may be calcifications in the pineal gland. So you may not have as much release. So it may be reasonable, to try. And you want to get a really high quality brand for melatonin. And then shifting gears to talk about different supplements. So a lot of the herbs and supplements work on the GABA system, which is a neurotransmitter in your brain that gets turned on when you're ready to go to sleep. It's also the same type of system where the sleeping pills work, the benzodiazepines to help relax you. And some of them really include things like chamomile. So chamomile tea actually has been shown to really help. Chamomile tea, there's a good study in folks with general anxiety disorder, and it can help with that. Sometimes I caution people with drinking too much tea at night, because if you have that liquid load, you can wake up to urinate. Yeah. Passion flower, hops, valerian root. There was a study with valerian root. Again, small studies, because herbs aren't sponsored by multi-billion pharma companies. But head-to-head trial with zolpidem, which is Ambien. And after 6 weeks, it was about the same. So, these things can really support you. Oral lavender. I'm a big fan of oral lavender because I like, essential oils. But at the same time, you can take an oral dose of lavender. It can help work on the GABA system as well. Some studies in nursing home patients where we want to get them off the benzos, right? We don't want them to wake up in the middle of the night, fall and break their hip. So we use some of these herbs, especially oral lavender or just lavender satchels, and it can help with the withdrawal symptoms of the benzodiazepine, which is really, really phenomenal. Magnesium. A lot of people talk about magnesium like it's like the holy grail.
For the lavender, where do you buy oral lavender? Because I don't think I'm familiar with it like that. I have it in a tea. Okay. Is it like a packet or a supplement?
Yeah, there's one by Nature Way.
Okay.
Yeah, that's the brand, Nature Way. So, your Whole Foods or your Sprouts or some of the specialty drugstores, they have it. Oral lavender by Nature's Way. I can send you a link for that as well if you want to take a look. Yeah. And some people, just make their own capsules, right? A lot of people in the essential oils world, you can have capsules and you just put whatever oils in it. But you need a carrier oil. Yeah, it has canola in it. And so people who are a little bit allergic or intolerant to canola oil, it may not be the best. But, some of the research just shows having a lavender spray near your bedside can really be helpful as well. Yeah.
I bought that recently. It's aromatherapy, and it has lavender in it, so you can spray it in your room. And then I also have essential oils where I can put on my wrist for sleep that has lavender in it.
I love it. I can smell it as you're talking about it. The thing about lavender and essential oils is you have to like the scent. So if you don't like the scent of lavender, then it's going to have an opposite effect. It can have a noxious effect. Going back to magnesium, a lot of people, I see so much information on social media about magnesium, especially magnesium glycinate or threonate, which, those are the ones that are less diarrheagenic. A lot of the magnesium can go through your gut that causes loose stools, which is good if you're constipated. Actually, not a lot of research out there. And it's so interesting. It's one of those things, it's pretty benign. It's not too expensive. If it helps improve your sleep quality, great. If not, don't waste your money on it, to be honest. And again, you can get so much magnesium from your fruit, the food. So avocado, bananas, nuts. If you can get it from the food that you're eating, you need to eat anyway, then you wouldn't have to spend money on some supplements.
Oh, okay. So there's not a lot of data on magnesium and sleep.
It's not peer-reviewed, randomized controlled trial, double-blinded, small studies. Yeah, I'm actually just sort of the commercial information versus actually the medical literature. There's a huge discrepancy between the two. But again, it's pretty benign. Yeah. So if you use it and it helps, great. For parents with kids with autism or maybe some behavioral issues, there's magnesium in the form of sprays or oils, and you can massage that into the kids' legs and feet. And sometimes that's really helpful. Some people who have restless leg syndrome, it can help as well. Epsom salt baths. And I think that's just something where it's part of a ritual, right? You're in a tub
Yeah.
at night, you're relaxing, maybe you add some lavender essential oils, you're soaking up the magnesium through your skin, which is a great way for your body to get magnesium. It can also support the sleep. Yeah, so there's just a lot of different options out there, and then sometimes it's really a little bit of trial and error. What are you interested
Yeah,
in
that's true.
doing, and what can help? Because for me personally, I'm like as simple as possible. Give me a piece of pen and a paper and let me journal out my thoughts, and that helps more than me taking a magnesium, more than me taking different types of supplements. Yeah, it's just let me get all my thoughts on a piece of paper,
Yeah.
and that can help soothe me to sleep, gives me peace. Yeah.
That's so good. I've seen quite a few influencers on social media. I don't think they're physicians or healthcare professionals, but they swear by magnesium. And there's one that even
Yeah.
says that one type of magnesium is better than the other. Like, the different forms you just mentioned, magnesium glycinate versus magnesium oxide, I think it is.
Yeah. Oxide,
And it's like a
citrate,
lot of argument
threonate.
about the
Yeah.
different ones. So I'm glad that you shared because I'm evidence based and I always like to say, okay, what does the data show? So I'm glad that you shared
Yeah. I mean,
that.
and then if it works for them,
If it works, take it.
fantastic.
Yeah, right.
Yeah. But I mean, to say like it's going to cure your insomnia, no, there's no literature that shows
Yeah.
magnesium, cures
And
insomnia. Yeah.
what you're saying about the quality of melatonin being different for different brands, I've felt
Yeah.
that because the brand that I'm using, I'm like, does this really have melatonin in it? Like I'm on the fence about throwing it out because I don't really think it
Yeah.
is working. And then to your point about magnesium, I've been taking it for a few months. I think it works, but it could be placebo effect. You know what I mean? Like who knows? And I'm trying to
Yeah.
take less medications, but the bath using Epsom salts with like lavender, there's some that has a lavender scent in it. That is very, very relaxing
Yeah. And
before
that's the
bed.
whole point of sleep, right? Getting your brain relaxed, getting into that peaceful, meditative state. So then when you are going to put your head on the pillow, your brain waves are already a lot slower and you're ready just to drift off.
Yeah. So you mentioned journaling, and I've shared about that as well as other stress reduction strategies, but those are good for sleep too. Journaling, reading. What are some other behavioral things that people can do around bedtime? Like I've read things like lower the temperature in your room. Like I turn the temperature down at night so that it feels cooler.
Most
Sometimes I'll get a
definitely.
warm shower. So what are your tips for kind of behavioral or environmental strategies?
Yeah, great one. Setting up your bedroom as a sleep sanctuary,
Ooh,
meaning,
sleep
right?
sanctuary.
Be minimalist. What you see around you affects your brain. Meaning, if it's cluttered, if you are like myself, I'm in my bedroom right now, I just have a home office. And if my desk is messy, or if I have a pile of books or a pile of mail that I need to get to, and I'm seeing that at night, my brain's going to be like, well, you didn't do all the things you need to do today. Why are things a little bit, and it sends you down a little bit of that spiral. So when you go to sleep, right, ideally it's cool, calm, and quiet. But even thinking about the pictures that you see, the plants that you have in your environment, right? So making sure it's less cluttered, right? Cluttered space leads to a cluttered mind, and it's really going to be hard to sleep. Noise, depending on where you live, if you can have, blackout curtains that also absorb noise. If your bed partner's snoring, that can be really challenging. If you have a dog that's barking, sometimes, earplugs can help. Listening to white noise, just background noise can help as well. I'm a big fan of talking about your nutrition, because I think we all know alcohol and caffeine can really disrupt your sleep depending on what time you ingest these things. But the quality of the foods, right? So plant-based diets are really shown to help across the spectrum. Things like, your heart health, right? Your brain health, but even your sleep health. Avoiding things that are processed, avoiding sugars, right, causes those insulin spikes, right? In small studies again, but I think we're going to get there, where if you have high fiber and less saturated fats, you have less awakenings at night. So less light sleep and then actually more deep sleep. And timing of when you're eating too is really, really key. Yeah, those
Oh,
are my
that's so
simple
cool.
tips, but bringing into the whole mind, body, and spirit framework for your audience.
Yeah, so fiber and less processed foods, you said in one study can help with
Most
sleep.
definitely, yeah.
And then you mentioned timing of foods, like Can you elaborate on that a little bit?
Yeah, so again, timing is so interesting and it goes back to your circadian rhythm. If you're more of a night person, you actually want to eat later because it can support your sleep. If you're a day person, you eat too late, it actually can affect how your body metabolizes some of that food. And then depending on the things that you eat, right, spicy foods can cause maybe some heartburn for some people and you don't want to lie down after. So I don't know if there's a specific rule of thumb and you got to figure out what works best for you, but I'd say 3 to 4 hours. You probably don't want to eat such a heavy meal. A lot of people right now are intermittently fasting, and we do see a lot of early morning awakenings. And I don't know for sure, and I think we're going to have more data down the line, but I am suspicious that drops in glucose, either from eating the wrong foods and causing too much insulin, can make your glucose levels go down, can also maybe lead to some of those nighttime awakenings. So if you are someone who's eating a little bit earlier and you do find yourself waking up a little bit early, or maybe you're hungry when you wake up, have a little snack before dinner, maybe some hummus or some carrot sticks or some cucumbers, things that are high fiber, some berries just to hold you over to see if you can make it through the night.
Oh, that's such a good idea. So, to see a sleep medicine doctor, do people typically need a referral or can they just like make an appointment with one? I don't know. I'm just asking.
Yeah, no, great question. It depends on your healthcare system. I'm in private practice, so if I take your insurance in Hawaii or California, you can just book a visit with myself. If you're in a big hospital systems, they tend to gatekeep just to make sure that the referral is appropriate. So you're probably going to need to see your primary care physician to get that referral. There are some online companies. Lofta is one of them. If you wanted just to get a sleep study on your own, you would just actually just pay them cash and you can get one shipped to your house. So there's a lot of options now. And I think it's making it easier to access because there's not a lot of sleep doctors. I think the percentage of people who actually do true sleep medicine, like aside from pulmonary neurology, is like less than 5%. Yeah, so
wow,
not a lot of
small.
options. A lot of primary care doctors do sleep, which is fantastic. And I think if it's like straight sleep apnea or maybe sleep hygiene issues can be helpful. But if you tried a couple things and you're not sort of getting the goals that you want with your sleep health, is, ask to see an expert. And just note that sleep medicine doctors typically do sleep apnea, movements, narcolepsy. There's another whole field of behavioral sleep where typically our psychologists, the American Society of Behavioral Sleep Medicine, for people who have insomnia or even people who have hypersomnia and are looking for behavioral techniques. And they also can help people who have a hard time using their CPAP from behavioral tools or psychological tools to help improve that. So depending on what sleep needs you have, if it's more of a physical thing, then yeah, the medical sleep doctor. I'm integrative, so I like to do, both sides. But yeah, if it's more of a mental health, anxiety, concern, habits, then see a behavioral sleep doctor.
Okay, that's so good. So you mentioned sleep apnea, and I want to touch on that too because we didn't earlier. I guess, like, what are the signs that someone might have sleep apnea and that they should ask a primary doctor or see if they need a sleep study?
Yeah, great question. This is my favorite thing to talk about, so I'm glad we're doing it. So obstructive sleep apnea, it's all in the name. There's a physical blockage. It happens only during sleep, and apnea means cessation of airflow. So really what it looks like is the muscles of the upper airway, typically the tongue or more downstream, are narrowing and collapsing. Typical signs and symptoms: snoring, gasping or choking, stopping breathing, feeling tired throughout the day. For women, and this is something that I love to talk about because up to 90% of women who potentially have obstructive sleep apnea are undiagnosed because there's a huge gender bias in medicine. A woman will go to their doctor, maybe overweight, feeling fatigued and tired. They're going to get, their thyroid checked and maybe have a discussion about depression or sent to a therapist. A male, similar characteristics, go to see your doctor, is going to get an order for a sleep test. So that's one thing. Common women presentations are headaches in the morning, fatigue, insomnia, maybe nightmares, difficulty staying asleep, and mood disturbances, which can look like so many things. It can look like menopause. It can look like perimenopause. It can look like thyroid issues.
I
It can
probably
look
have
like
that.
depression. Yeah. And so 1 in 5 adults have it. And it's so easy to do a home sleep apnea test now. I don't like to blanket testing, but this is definitely one that I would say everybody needs a sleep test just to rule out. And it runs in families, and you don't have to be overweight or obese to have it.
That's so good. Yeah, when I was doing primary care, I remember asking those questions about early morning headaches, weakening during the night, and I had quite a few people that Turned out I had sleep apnea. But sometimes trying to get the sleep study was a challenge. I don't know if it's still like that, depending on their insurance company.
Yeah, it really
was a
is.
bit of a barrier sometimes.
There's a lot of gatekeeping that's done, which I think, maybe in my next life, that's what I'm going to do, more advocacy with the, right? Because it just depends on the policy, the research that's done.
Yeah.
But before 1993, I think, right, women weren't required to be in medical literature. And so if you're not
having what year?
1993.
That's pretty recent.
Yeah, exactly. Wow. So that's why, the way we practice really isn't geared towards women, right? Especially women in midlife, because, I don't know, I barely learned about menopause. Right. I never heard about perimenopause till like a year ago. So it was just like,
I'm like, what? How am I just now learning about this?
Yeah. And, we're half the population, depending, maybe more so. And we live longer. So there's just so much that needs to be done. And that's why I'm so thankful that I'm here talking about the message of sleep for women. And you have this platform, Dr. Judy. Yeah. So you can help as many ladies as we can. Yeah.
Thank you so much. I know there's going to be so many people listening that's going to rewind and listen to this back. I'm like, oh man, I've been having that. Let me call my primary doctor and see if it can be that. And that's why I like to have this podcast to bring different specialists on, because I know from a primary care doctor standpoint, it is very difficult to get everything done in that 10-15-minute visit. So it's better for you as a patient.
Right.
The more information you have, the more analysis that you've done on your own conditions, such as knowing what your symptoms are, knowing when they happen, knowing what makes it better and worse. And then even, I like people to get a little bit of reading their own, like with the internet now, you can read. So that's why this podcast is to empower people, so that you're not just like going to your doctor and being like, oh, I have headaches. What you might say? Maybe you'll say, I have headaches, problems concentrating, like brain fog. And then maybe you'll be like, I'm having trouble losing weight, right? You can help put it together for them if you read this podcast or listen to this podcast, and you may be like, oh, I never thought it might be sleep, right? So that's the purpose of it, to bring people to you that you might not otherwise either see in clinic or never meet in person, because I have accessed and a lot of connections with different people. So I love bringing people on like you.
For sure. Yeah. Some people have listened to a podcast and didn't realize that they had these symptoms, or didn't realize the questions to ask their doctor.
Exactly. Yeah.
And
all the symptoms to tell them about.
Exactly.
All the symptoms to tell them about. Yeah.
Yeah, for sure.
Yeah, knowledge is power. This is so good. So thank you so much, Dr. Cacho. We'll have all the links below. So one last question I like to ask all my guests. What's one take-home point that you want the audience to get from this podcast? One or two.
One or two. I'd say number one, you don't have to be tired. You can live a very fulfilling, energized, purpose-driven life. And if you are tired, talk to your healthcare professional about what could be going on in your life from a mind, body, and spiritual soul standpoint.
I love that. You don't have to be tired. And with that, we'll say thank you so much, Dr. Cacho, for joining me on the podcast. This was amazing, and I enjoyed chatting with you, and I know our audience loved it as well. To my viewers, thank you so much for watching, subscribing, and supporting. Be sure to like this episode, share this episode, subscribe to the channel, all the things. And I'll see you in the next episode. Bye.